Hi, this is Dr. Levine, and welcome to my YouTube channel. Thank you so much for entrusting your care to me. If you're watching this video, it means that you have an unstable shoulder with significant anterior glenoid bone loss, and we have discussed proceeding with an arthroscopic distal tibial allograft reconstruction and related procedures. What does that mean? It means that you have a lot of bone loss on the socket part of the shoulder, and that simply doing a soft tissue repair would fail. So what does that look like? It means you're going to come to the operating room on the day of surgery. You're going to meet the anesthesiologist. You're going to get an interscalene regional block, which means they're going to put your shoulder to sleep, but you don't have to have general anesthesia. You don't need a breathing tube. They will make you drowsy. Sometimes this is called twilight anesthesia, and very similar to if you ever have a colonoscopy in your life. The surgery itself takes about 1.5 hours. It's done through a series of small incisions around the shoulder. A camera is placed into the shoulder to do the operation. And a small incision on the front of the shoulder is necessary to bring the bone graft in. The distal tibia is the lower part of the tibia, the lower part of the ankle bone, and we're using a cadaver bone, not your own, and that geometry of that bone matches the geometry of the glenoid, the socket, almost exactly. We're going to transfer that piece of bone into the lower part of the socket. We're going to hold it in place with screws, and we're going to do associated repairs of the soft tissue above and beyond so that we have both a bone and soft tissue augmentation and reconstruction. After the operation, you'll be placed in a sling. The sling is to be worn at nighttime when you sleep, and when you're in public, you'll come out of the sling the day after the operation to move your elbow, wrist, and fingers. We'll see you back for your first post-operative visit at 2 weeks after the surgery. At that visit, we'll make sure the wounds are healing nicely. We'll get x-rays to confirm everything looks good. We'll discontinue the sling, and we will begin formal physical therapy, which will last at least 4 months, and typically you'll go twice a week. You'll continue with your range of motion recovery for the first 3 months after the operation. That's called phase 1. So the goals are very simple. Get your motion and flexibility back while allowing the augmented glenoid with the distal tibial allograft and soft tissue reconstruction to heal. We then begin phase 2 from month 3 through month 6, and that's where we're really working on strength and functional recovery, really important time. Your second post-operative visit with me will be at 4 months after the surgery. At that visit, you'll have had regained hopefully all of your range of motion, and you'll already be working for a month into phase 2 on your strength. So you should be very functional and doing quite well. We will then see each other back probably around 8 months post-op, and that may be the last visit depending upon the individual. So I hope this helps you understand the timeline and what the pathway looks like following your arthroscopic distal tibial allograft reconstruction. This is Dr. Levine. Thank you so much for allowing me to take care of you. If you have comments, questions, or concerns, please don't hesitate to let my team know. And we look forward to eliminating your instability, getting you back to your game, getting you back to full range of motion, function, and strength. Thanks very much.